Welcome to Let's Talk About It. I'm Gerry Henwood, and today I have the pleasure of talking to Dr. Jennifer Brown and Tracy Finney from Rocksteady Boxing. And welcome to the show this morning.
Thank you.
One of the things that I'm fascinated about Rocksteady Boxing is that you ladies are specializing in balance disorders and movement disorders. Mm-hmm. Could you tell us a little bit about how this all got started, Jen?
Sure. So we are physical therapists, and my practice is called Dynamic Home Therapy. And we go to clients' homes that suffer from any type of neurological diagnosis. That's our specialty. So we see a lot of clients who go to movement disorder specialists, and our main diagnosis that we were seeing a lot of was Parkinson's disease. So with therapy, whether they were getting PT, OT, or speech, once they, we call it graduated from therapy, there was really nothing else for them to continue with. So then we would be getting them back again for therapy, say 3 months later. So it really got me thinking about what was there locally for the community, for this population of people who really benefit from exercise. And Rocksteady Boxing is an international program, and Tracy and I have been friends forever and always talked about it. And it just worked out that, I saw the local training coming up. Not local, but we had to go to Indianapolis. But, easy to get to. And I got certified last January and came back and talked to Tracy, and, she was on board. So it happened very, very quickly.
Yes.
And we had an open house in March. We were just renting a space from a local karate studio because we weren't really sure, of the needs and how many people. But we started April 3rd last year in Wayne, and with 8 people. And by the end of the summer, we were outgrown, definitely, of our location. So we ended up looking for spots, and I was trying to find something still local to this area for the community. And we found our location in Devon. So we moved there in October, and there was a great following, and now we're up to about
like
70. Yeah, about
Wow.
70 boxers, yeah.
Well, one of the things, as I've become older, friends of mine have been diagnosed with things like Parkinson's. Mm-hmm. When they haven't been diagnosed, it's just been a balance disorder, right. And they're very concerned about falling. Mm-hmm. So could you tell me, maybe Tracy, you could comment on this, mm-hmm. What kind of exercises and therapies do you employ that help with these types of issues?
We do a lot of specific balance testing and balance exercises in the class, whether it be with the boxing or walking heel to toe against the bar. Everything they're doing, they pretty much have to balance. So we're working on that throughout the whole class, whether it's specific balance exercises or because they're standing and moving their arms, they have to balance. It's very dynamic. The whole class is very dynamic. Mm-hmm.
Now, does it matter what kind of balance disorder they have or the origin of those disorders? Mm-hmm. Do you find that the exercises you conduct with your clients benefit all of them? Jen?
Oh, absolutely. So the one thing to specify is that Rocksteady Boxing is specific for people with Parkinson's diagnosis or a Parkinson's plus diagnosis. So many people don't know what that is. So if you hear of someone that has Parkinsonism, there's all different variances of it. But anyone that has any of those diagnoses benefits because there's different classes that we hold for each different type of diagnosis. Mm. So it is very geared specific to their needs. And no matter what level we have people who are still working, driving, very independent, all the way to people who've had the disease for a long time. They might need a wheelchair to get around in the community. There's also a special class that we run just because we work with that group with our practice, but who have what's called Lewy body dementia, and that is under the Parkinson's plus syndromes. So for that diagnosis, there is a lot of cognitive impairment. and they do require to come with their caregiver, and they're called their corner man or their corner woman. So it's more of a group
And they're very
approach.
involved. They're in the exercise program right next to the boxer,
But even
working with them.
people in that level of class are benefiting. People are getting up more. It might be the only chance they have to walk that week when we're doing class. And the input that we're getting from family members is that it's life-changing. So there's many people that have come in where they needed help, and now they're able to do things on their own.
Oh, that's wonderful. Could you tell me when people first come to you, what can't they do, and how long does it take of exercise to get them moving in a more positive direction? Could you give us some examples of some of the more severely impaired people, and then what they've been able to accomplish? Tracy?
Well, we do have a boxer that came in. It took him like 20 to 25 minutes to get out of the car with his wife. Every day they would come, and it was difficult. And now that's been in like 2 or 3 months maybe. He's walking with the walker with his wife, not using the wheelchair to get into the car, and they just get in and out of the car without much difficulty. So he's definitely made a lot of progress, but it depends on each person and their diagnosis. And, you know, I mean, I would say everybody sees some benefit. A lot of people see a lot quickly. It just depends on their diagnosis.
That is so hopeful for
Oh, it is. It is.
patients.
Yeah.
There is, just to add on to that if I can, because we had another person come in who was very ornery and really didn't want to work out. Most people come because their spouses need them. So that's what we get, but then they become like lifelong people that don't want to stop coming. But he was on a walker, and he had caregivers at home, and the first class he came to, he needed someone holding on to him the whole time.
Like right next to him the whole entire time.
And within a month and a half, no walker, no caregivers, he's golfing, he's driving, he's helping people up off the floor that need help now. And I don't think he realizes how far he's come.
I definitely don't think he has, yeah.
So there's lots of, and it also helps, anxiety is a big piece of the disease. And for some people with the cognitive impairments, it can cause what's called like a freezing, where their dopamine levels become low and they actually can't move, they get stuck. So sometimes it can go into very, very significant anxiety, and they need to take medication right at that point. And there's one particular woman in her early 60s, and when she comes to class, it fights through that. And her husband said that's the only thing that he's noticed that has helped that significantly with the anxiety.
Now, I know you're not medical professionals. However, because both of you have PT backgrounds, but do you have any comments to make about what happens to the body to facilitate this kind of recovery or improvement in movements? You mentioned dopamine.
Yeah. So with Parkinson's, there is a loss of dopamine. Most people, when they're diagnosed, have already lost about 80% of their dopamine. So you can be diagnosed when you're 70, but this could have started back when you're in your 40s. A lot of the symptoms you don't realize at that point. There's also a significant loss of smell. There's things looking back that people tell us that they didn't realize. So with the exercise, a lot of these folks are on medications to make dopamine for them, so to say. And the medication is great, but the exercise at a high intensity, and that's the whole idea of this, it's forced exercise to get their heart rate up and to get them at a much higher level than what they can work out on their own. It doesn't make more dopamine, but it allows the neurons in the brain to fire better, and it actually keeps their medication working more efficiently with this particular type of exercise. That's what the studies have shown.
I see.
We push them. Like some people exercise anyway without us, but when they come to our class, they say, oh, we don't push ourselves this hard. So it's the pushing of the patients, the boxers, that really separates us from just exercising.
What is your relationship to any of the specialists that they're seeing? Do you have a relationship with them?
Yeah, I mean, Jen, through her physical therapy company, has a relationship with a lot of the neurologists in the area. So they do send boxers to us. and we communicate closely with them if we are seeing a problem. If we're seeing symptoms that are exacerbated or that just change from when we initially saw them, we'll keep in close contact with them.
Mm-hmm. And it's a very specialized area. So there are neurologists all over the place. A general neurologist can see thousands of types of diagnoses. A movement disorder specialist is someone that specializes in Parkinson's. So it is very important, and we educate our boxers. We call them boxers, not clients. That it's very, very important to see that specialist. Just like for therapy too, there's a ton of therapy practices, but you have to be careful if it's not someone that specializes in Parkinson's, just like the physician, you may not get what you need out of that. Mm-hmm. So it's really, really important to educate also on that piece of it with them.
Now, when they come for their session, how long is the session?
The classes are about an hour long. They come a little bit before and a little bit after, but the sessions are about an hour long.
Mm-hmm. Yeah. And does insurance cover this?
Right. So insurance does not cover it, unfortunately, because it is considered a group fitness class. So it would just be like someone joining a local gym, a specialized like boutique or a yoga studio or something like that. Mm-hmm. So it is, and different rock steadies do it differently. Some people do it like a monthly membership. Some people that are still working can't get to class as regularly as they'd like. So they might go to different rock steadies depending on where they are. It really varies.
So when you say they can go to different rock steadies, mm-hmm. in our area, for example, do you know how many of them there are in the locations?
So just in our area, up and down from Manayunk up to Paoli, there are, and covering over to Delaware County, there's 5. There's a couple in the city for people that live in the city. There are a couple in Bucks County. Yeah, there's about 3 or 4 between Lower Bucks and Upper Bucks. Mm-hmm. So what's really nice is that, the coaches from the different locations, we become colleagues because you might be talking about certain boxers that you're sharing, or if they go on vacation, there's like a reciprocity so they can go. Let's say they're going to the shore for the summer. There's one down the shore.
Because it is important for them to keep going. Like we had a guy visiting from San Francisco, and he said he had surgery for like 2 months and stopped rock steady, and he could really tell the difference. So if they're going on vacation, they want to keep going. Mm-hmm. Yeah. So if they stop into another rock steady in Florida, they're very welcome to go there, and we can share information that we have with them.
And if they're traveling outside of the country, even there's some internationally now.
Italy, Japan, I think. Yeah, and it's pretty amazing. Mm-hmm.
So it's very much like a Weight Watchers.
Kind of, yeah.
They have different satellites mm-hmm. all over the world.
Yeah, and I think what's important, what's a little different than like a gym membership is part of Rocksteady is when they come in, they have to do an assessment with us. So the assessment consists of a couple balance tests, 3 different balance tests, and then just a general assessment of their health and their mm-hmm. Parkinson's and their symptoms, and so that we can put them in the proper class, and we also know what to look out for. Mm-hmm. If you have a knee issue, we're not going to make you squat if that's going to bother you, or we know what to look out for based on your symptoms.
Right.
Yeah. So it's very specialized.
Got it. Mm-hmm. So if anybody who's listening to our program and watching it would like to either get more information about Rocksteady Boxing, they can Google you, right?
Yeah, they can, and they can look up the national website, rocksteady.org. You can type in your zip code, and it can show you locally,
find any Rocksteady.
Any Rocksteady. People can call just to come and observe a class, which is really nice because some people are very intimidated. Mm-hmm. It is not boxing the entire class. So that's something some people think, oh, well, I don't box. And it's not, you're not boxing anyone.
Right.
The idea, right, it is boxing because that is what is shown to really help with some of the symptoms of Parkinson's. But it's also cardio. You might be on the floor doing some floor work. It's balance, it's posture, it's voice.
It's everything.
Breathing, all the things that Parkinson's can affect.
Mm-hmm. It's cognitive, it's, multitasking, switching from station to station, having to do 2 things at once, working together. It's, partner stuff. It's everything.
Yeah, and people call all the time, and we can give them information or just kind of talk to them. We also have other boxers who kind of act as mentors, and if someone wants to talk to them, more of
They'd be more than happy to do that.
Yeah.
Yeah.
So
It really
it's nice.
has become a close-knit group too. I mean, they go out and do things aside from within Rocksteady Boxing. They'll go have coffee or
Yeah.
give each other rides to this class and
Yeah. But it's very
pretty-
positive.
yes.
Well, I was just going to say that with hearing the word mentor, you know that those people have benefited from the classes if they want to volunteer becoming mentors to others who may just be getting started.
Yeah, because it is intimidating, I think, for some people. Like she said, some people come in and we always ask, why are you interested in the class? And some people are sitting there like, well, my wife's making me do it, or my daughter, but they've all stayed. I mean, we haven't, nobody has gone away except for if they're sick, but everybody has stayed and they like it now.
Oh, that's great. Are
Yeah.
there these exercises that you do with them? Are they able to continue when they go home, not necessarily do the boxing exercises, but do other kinds of exercises on a daily basis at home to practice what you've been teaching them?
Right. No, that's a great question. Well, yeah, so I think, and that's what's a little bit different. So being physical therapists, we're probably harder on that. We're looking at much more with their posture and other things. So we do, whenever we do something, we're telling them this would be good to do when you get home. These are what you can do over the weekend.
As long as it's something safe for them to do.
And some people actually end up going and buying like a small little bag for their basement or their living room. And, just because when they don't do it, they notice, like for some people that come Thursday, we don't have a Friday class yet. So they notice between Thursday and Monday, things kind of like go downhill sometimes if they're not getting more movement in on their own. Yeah.
And that's why we encourage them to come to as many classes as they can in a week.
Right.
Because you really feel more of the benefit that way.
Well, now you mentioned when we started talking today that you started out, I think the number was 7 or 8 people, and now it's up to 70.
Yes.
And how many classes do you run every week?
We have 9 classes a week.
Yeah, no, 10 now.
10?
Yeah, we added, yeah.
And
10.
6?
Yeah,
7?
2.
Oh, the
Oh, no,
Broomall.
11. Right, if
Yeah.
we include Broomall.
Yeah.
So there's another satellite in Broomall. That's actually 11. But yeah, just in this location, it's 9.
so, and you work in each class together with the patients, or
In
do you conduct
some.
individually?
In some. So all of our coaches, and like Tracy said, each Rocksteady locally is different. In this Philadelphia area, there's 2 Rocksteadies that have therapists on staff, and that's ours, and then the one down in the city, connected to Penn. So we really try and have people that are medical backgrounds on our team as coaches, just because of the complexity of the clients. So we have a speech therapist, we have 4 PTs, we have an exercise physiologist. So usually,
And a nurse.
oh yeah, and a nurse too, right? So there's either a PT, one of us, and a volunteer. So it's also a very big community-driven volunteer program, and we're always looking for
We're always
volunteers.
looking for volunteers.
Yeah. You have to be 18, but even if we've had grad students for medical school, we've had just retired moms that want to come in or stay at
We have a
home
student in
moms.
college, and when she comes home for break, she comes back and volunteers for
So
us.
we try and have 2 people in each class, depending on the complexity of the class, because as the classes for our levels that there might be more cognitive impairment, you definitely need 2 people. For our higher, they're called our HIT classes. That means that there's really not much transition time. You might be on the floor. You're doing all kinds of crazy stuff.
And we might be doing advanced balance tasks
Right.
for those people because they need to be challenged more. So we might
Yeah.
need extra hands guarding them as they're standing on
Yeah.
a Bosu ball. Or
Right.
Right.
And so the volunteers are very, very important if people, ever are interested. We try and we did our first training a couple of months ago. So
Oh, that's
it's a big part. It's a big part of the
yeah.
program.
That's very good to know. Now, what about the caregivers themselves when they bring a boxer to you? Do they stay? Do they observe? Do they help out?
So like Jen said, there are the 2 levels of classes that have to have a caregiver with them because there might be cognitive, disorders, or they have to stay in the class with them. They have to stay, they have to participate right next to them, they have to help out. And there's an agreement and training that we go through with them, just briefly. But the other classes, caregivers do come sometimes and watch, not really participate, but they They
Just
do
to kind of
watch,
see what their
just to
loved
kind of
one's
see what they're doing, and sometimes they're
Right.
amazed. They're like,
But what we found is it really becomes like a built-in support group. So most of the
definitely
people
is.
that come to our classes don't go to any support groups for, even though there's a lot in the area, because they have that there. So every class, even with the caregivers, we're always in a circle. You introduce yourself, and there's always like a question of the day, and it's usually funny and lighthearted.
it's, yeah.
Yeah, but even the caregivers, and for them, they're frustrated a lot of times. They need to get out also and socialize. So, you get to see the same people on a weekly basis, and it becomes really nice.
It's like a little family.
Yeah.
It's really neat. Yeah.
Oh, that's wonderful.
Yeah.
Now, I know there was a lot of research done before this rock steady boxing began to support the rationale for the franchises and the organization. Is there any continuing, ongoing research that you're aware of that anyone's doing?
Yeah, so actually there are a couple of PhD physical therapy professors in Indiana that are working very closely with the headquarters, and they are doing research as we speak with actual boxers and doing pre-measures and outcome measures, and that's why also we do a lot of the testing before, so we kind of have a baseline, and then we can compare
how they
it months
progress.
later to make sure there's a progression. But in general, there is a huge growth in the research that's being done with exercise, and there was just a great presentation on Friday over in King of Prussia, and they were talking about, it was a movement disorder doctor and neurologist, that exercise is medicine. So in Parkinson's, the only treatment out there is medication. The only other treatment that is showing to help is exercise. So you can't skip your medication with Parkinson's because your symptoms can turn very quickly like that.
So why skip
So
your
you
exercise?
wouldn't skip your exercise. So that's really what they're looking at. And they looked into boxing specifically because boxing is, ESPN did a study that it is one of the most taxing, exercises and sports out there because it includes everything: hand-eye coordination, cognition, multitasking, physical, core, balance, endurance, cardio. So that's where it kind of all began too.
And with the boxers reaching for a target, like without a target, they might just be punching like this. But if there's something out, they're reaching all the way out. So a symptom of Parkinson's is kind of being small movements, kind of being flexed in, but they reach all the way out. So, and we challenge them. So it's really interesting.
That in itself is a very good example.
And they like to box. I mean, they get aggression out. They, it's fun.
Anxiety, depression, stress.
Yeah.
It's huge.
I'm surprised that fitness programs generally have not integrated more boxing into their programs. I'm a member of an organization, and I go for senior aerobics class. I go to work out in the gym, but they don't offer.
I think there are more popping up that we've noticed.
Yeah, I've noticed where there's more like
incorporating
franchise kind of places with boxing.
Yeah, just for boxing. I think it depends too, probably on the clients, and there is a lot of risk of overuse injury
with your shoulders and
so.
teaching the right way to box, using your body and your core, not just using your arms, because you will get shoulder injuries or soreness if you just use your arms.
Well, now, speaking of the training that you need, what kind of training did you ladies need to get in order to know those techniques so that you don't hurt yourself or others? So could you tell me how you got your training?
Yes.
Yeah, my training was, so I went to Indianapolis to their headquarters, which was like a 10,000 square foot huge studio,
right?
Beautiful. And their classes can have up to like 60 people at a time.
I was going to mention that before. They're so big out there. Where the Rocksteady originated in Indianapolis.
So when I went, I learned there, and I had never. I took some kickboxing classes, but it was overwhelming for sure. So. And then I got certified and came back, and then they allowed an affiliate, like an online training,
which is what
I
did.
Everyone could get out to Indianapolis, and then from there, we just kind of I started taking classes with Tracy a little bit, and there's a forum, there's something you can reach out for support for all the coaches, lots of learning.
Everybody gives ideas. All the classes have a general theme of what you need to do, like warm up, boxing, cardio, stretching. but you kind of make up your own. So you can share classes, you can share ideas, people post videos. It's a very great community for
Now,
sharing.
In many professions, you have to take every now and then a retraining course. Is that required in Rocksteady Boxing?
So for Rocksteady, it is not. They do have, they just started implementing last year a yearly coach conference. So in September we did go, and that was in September in Philadelphia.
Which was great.
Yeah, it was fun. It was
For
great,
us.
local, and they did the Rocky Run and everything. And
It was cool.
but so for that, then you learn a little bit more. So for people that want to advance a little bit or learn more, they do allow, different conferences of that. But as far as our background, because we're physical therapists, we are required to have yearly continuing education credits. So a lot of what we do are different certifications in Parkinson's. So it's a little bit different for us because we're already getting that piece of it.
And some people who do Rocksteady are fitness professionals, so they might be getting different fitness certifications and getting extra learning that way.
Right. Now, I can tell just by our conversation this morning and talking about Rocksteady Boxing that you yourself are finding gratification. It's not just a business. You're talking about...
They become like our family. I mean,
Yeah.
it's amazing to see them struggling with their Parkinson's, and then they come in here and we see what they can do, and I'm like, maybe I should do more. Maybe I should push myself some more, and they're very positive. It's amazing. It really
They're
is.
sending us pictures from their vacation.
Oh yeah, look what I'm doing on vacation. I, went to another Rocksteady Boxing, or, they're very appreciative too. It's pretty amazing
It's a great
group.
of people, yeah.
Oh, that's great.
Yeah.
Well, before we end our chat today, is there anything that I've not asked you that you would like to perhaps mention that would be helpful to any of our listeners in the community about Rocksteady Boxing?
Yeah. The only thing I could think of is that, for some people, it may not be their thing. And I think we really stress that it's as long as they're doing something, as long as people with Parkinson's are doing some kind of exercise. And if it's intimidating, if they're not sure, they can come and watch.
And we can always help them figure out what might be better for them. There's lots of things out there for Parkinson's, and we can always help if boxing isn't their thing.
One of the questions that just popped into my mind is that before Rocksteady Boxing, as you said, people were treated with Parkinson's with medications, and this is relatively new. So is it ever too late for someone who hasn't had the benefit of this kind of exercise to begin as somebody who's just hearing about the program?
It's never too late.
It's never too late, no.
The benefits, the sooner someone starts from the day of diagnosis, the better the results, for sure, because they're being more proactive, right? But a lot of folks who may have never been exercisers, that was just not their thing. It's better to start at some point than not to do anything. The people that don't do anything, that's where there's a lot more stiffness and pain and depression and decline in mobility, and it's just a downward spiral.
Right. Well, Jen and Tracy, I want to thank you very much for
so
coming
much.
in today. It's been wonderful chatting with you, and I hope you, our audience, learned a lot about the topic of Rocksteady Boxing. Thank you.